Chemical peels are one of the best treatment options for skin damage correction and rejuvenation, but there is a lot of misconception associated with them. Skin peels are used to address common issues such as pigmentation, perhaps from the sun or pregnancy, and age lines. They're a very effective tool for addressing long-term skin damage. We also use them to good effect for acne. And of course, we can use superficial peels just for rejuvenation, like a red carpet treatment perhaps before a wedding or important occasion. Skin peels are products that contain either fruit enzymes or acids. Now the word acid can sound quite scary, but these are made from foods and plants that we commonly know. For example, mandelic acid is made from almonds. Glycolic acid, which is a very well-known peel product, is made from sugarcane. I have, however, encountered some shocking practices where therapists have underestimated the potential power of a peel product, or the actual peel that is used is acquired from unknown or unreliable sources abroad. And of course there are home peel kits now that people often buy off the internet, which are completely unregulated and often counterfeit, and that's where complications can occur. So as a medical clinic, we have only approved suppliers to make sure that we're getting the product that we think we're getting. And of course the most important thing is to undergo a thorough medical consultation to ensure that the person's skin and their needs are going to benefit from the peel you intend to use or the treatment protocol. It's also very important, particularly with acid peels, that the person undergoes a period of pre-peel preparation, which needs to be 2 to 4 weeks long, and the aftercare is also equally important to avoid any unwanted side effects. If all that is done, actually what we can achieve is usually very little or even no downtime in some instances, and quite remarkable effects in terms of skin damage correction. Many people are understandably worried about looking very red and peeling a lot, and essentially looking like they've been badly sunburnt. And although there are peel products out there that can give this intensity of downtime, we tend to favour superficial to medium depth peels, which cause relatively little and sometimes no downtime at all. Also, peel technology has advanced considerably over the last 5 to 10 years. So some of the peel products we used, for example, based in an aloe vera medium, thereby causing much less irritation to the surface of the skin and therefore less redness and peeling. Another brand we use, which is very well known, is actually classed as a medical device rather than a peel, because at a molecular level it transports the acid down into the deeper layers of the skin before it is released, and therefore the surface of the skin is not really exposed to the acid in its active form, and so again we can actually achieve quite a good deep result without the patient suffering with a lot of downtime. Lastly, we've developed some very unique treatment protocols. So what we can do with this is combine peels with other treatments. By doing that, we can administer a less intense peel because the beneficial effect is going to be compounded by the supporting treatment, which may be mesotherapy or microneedling.